Hello friends, I am Dr Sourabh Patwardhan from Nandadeep Eye Hospital PG Teaching Institute and FECO SICS Training Center, Sangli, Maharashtra, India. In our center, we have a lot of teaching activities which includes hands-on training as well. In this video, I'll be showing a case where there was IOL shooting. Why it happened and can we prevent it in future cases? So let's have a look at this case. Cataract has been already removed. You can see a nice capsulorhexis. The bag is inflated with 1% sodium hyaluronate. I am going to use a single piece hydrophobic IOL and it's open cartridge like butterfly, where I am going to insert it into the groove and then load it over the injector. This is a 2.8 incision and the injector is meant for that, but as I start injecting the IOL, I find that the cartridge little bit comes out and there it goes. The IOL just shoots into the bag. Just watch it again as the injector goes in. There the injector just little bit comes out and I have to push it little fast, and then there is suddenly a giveaway, and that lead to shooting of this IOL into the bag, or rather equator of the bag, rather forcefully. And as you can see here, it just shoots very quickly and I cannot control the shooting because I am already pressing the IOL little bit more, as there was more resistance from the wound assisted delivery which I was trying here. So if you see it in the slow motion, what you will find is that once it shoots, it goes very quickly into the equator of the bag and almost tears the bag completely here. Luckily the anti-hyaloid appears intact and that's why the IOL springs back into the bag. And now I have to think what I have to do next. But before that, what are the causes of such shooting? I have had this in just one case prior to this. It's not a very common occurrence. It happens more with single-handed delivery, though of course the two-handed delivery has its own issues. Wound-assisted delivery is commoner because sometimes there is sudden giveaway when we are doing wound-assisted delivery. Fast push, faulty injector. Sometimes the injector has variable resistance. As you push, suddenly the resistance decreases and you shoot fast. Also, visco leak during the injection makes the bag more prone for trauma if the IOL is shot little quickly. So we definitely need better injector systems which are in between the two-handed and the single-handed delivery system. So something like these are in the development. I am sure they will be replacing all these routine injectors which we are using at present. Because of this, of course, this is a very rare occurrence. I have used almost maybe say 50,000 IOLs and this might be just second time I had this issue. It's good to have a nice injector cartridge where you can avoid a wound assisted delivery, and also you have to push little slowly as you go along, and always be watchful when you are injecting IOL. So in this case the anti-hyaloid is intact, though I am sure that there is a peripheral capsular tear there, but I think there is enough space for the IOL to be placed in the bag, and there is enough equator of the bag left which can support the IOL well. Luckily this tear is on the nasal side of the patient's bag, so if it was inferior then gravity may cause a dislocation of the IOL, but here it's nasal and I'm sure it is small, maybe 2 or 3 cloacas. So once the IOL is placed in the bag with the haptics quite away from the area of peripheral tear, I am sure that this IOL will remain in the bag and well centered in the future as well. The removal of viscoelastic has to be done at a low IOP. So I used here just 25 to 30 millimeters of IOP on Centurion and just washed off the visco. If I don't have a lower IOP controlled machine, then I will just do a visco wash by cannula without using active aspiration, so that you don't have further anti-hyaloid rupture or vitreous prolapse. So that's the end of the procedure. We are quite sure that IOL will be doing quite well here, but definitely we look forward to better injector systems which are more controlled, where even if you push hard, they should not exceed a particular limit of pushing speed. So I'm sure these injector systems are in the making, and we are looking forward to use them in future. Thank you so much for watching. Please do describe if you had similar events in your cases previously, which IOLs were more prone for such events, and do subscribe to my YouTube channel. Thank you.